Hey everybody, here's another Access Live on Facebook, and I'm here today with our Vice President of our North Campus, Jeremy Howell, and our Assistant Chief of Staff, Dr. Philip Wilson. We're so excited to have you both. Thank you for coming. If you actually notice, we are not in a clinic room. We're not in a Gait Lab. Well, we actually are in a Gait Lab, but the future Frisco campus. So today we'll be talking all about what's going on, the update on the construction, and then some of the services that are going to be provided at our future campus. So Jeremy, can you give us an update on the construction? What's going on?
Yes, absolutely. So, thanks to our general contractors, Beck, and our architects, HKS, they've designed and have constructed a beautiful building that is running right on schedule. And we are still anticipating with getting access to the building in the fall of 2018 and first patient day in October of 2018.
So I know that we're really big in the community here in Frisco, and we're really trying to build that up as we open up next fall. So can you talk a little bit about who our neighbors are? I know we have the Star across the way and maybe some of the school districts that we're going to be involved with in the future.
Absolutely. So we're at a great area on the toll road on the northeast corner of Lebanon and the Dallas North Tollway. And we're right in the heart, or really at the top of what they call the $5 billion mile. And some of our partners north of here is Frisco High School, which is just north of our property. So they're our direct neighbors we share a fence with. And then to the south of us, we have the new Wade Park development, which will go there as well. And so we're very excited about that. And then beyond that, the Star is just a little bit south of here is also.
I think it's really exciting because there's so much going on up in Frisco. I mean, there's construction everywhere, so it's a very cool and, it's a very rising community to be a part of. So, Dr. Wilson, I think to kind of get into some of the services, and I think the big question is, what's going to be the difference between, our current Plano campus and maybe what people can expect at the future Frisco campus?
Sure. We're extremely excited about the campus because it will really give us both physical space and resources to expand all of our current offerings. Our physical therapy space will expand, our clinical rooms will expand, we'll have operating space here on this campus, which will be an enormous improvement in access for our patients. From a sort of a expertise and what we can offer the community, our motion science lab and our physical therapy space will allow not only us to do more research and study, but also, add some real clinical care advancements. So we're really excited about the campus overall.
And I understand that we're going to have day surgeries here. So can you talk a little bit about kind of the operations and maybe what all will be happening that, on top of what's already going on at the Plano campus?
Sure. The operating room will allow us to do the majority, almost all of our sports surgery on this campus, allow us to have more access for our fracture care that needs operative treatment or anything that might require some sedation, and really allow us to bring those things closer to the community, improve our efficiency and our access for care for our patients. And so we're really excited about not only the update of facilities we'll have, but just the accessibility that we'll have to that.
So to kind of get into the actual structure, can we get into, Jeremy, how many floors there are and kind of what's expected on each floor?
Yeah, absolutely. So the building is actually 5 stories tall, and so where we are right now is our first floor. And on our first floor, we're going to have conference rooms that will help benefit the community and also be used for physician education and outreach. We're also going to have where we're at right now is the Gait Lab, or Movement Science Lab, which is going to be really used for research purposes. And then directly behind us is a physical therapy, a very large sports physical therapy area that's going to allow us to rehab our patients, and as well as MRI and advanced imaging on the first floor. Our second floor contains all of our clinical space, outpatient clinics, and that really starts with our anchor clinic in sports medicine, and then fracture, and then we're going to have a rotating clinic that's going to consist of scoliosis clinics, general orthopedic clinics, hand clinics, rheumatology clinics as well. And then also on that floor, we're going to have orthotics and prosthetics. Our third floor is going to be completely shelled for future growth. And then our fourth floor is where we're going to house our day surgery unit that Dr. Wilson was mentioning. And then the fifth floor, it will be more general administrative offices for the staff that are here.
And that's so great because we know that we're going to continue to grow. I mean, this is not when we first open. I mean, it's just exponential that we'll be able to do that. So that's great. So Dr. Wilson, I know he mentioned the general ortho services that are going to be offered here, which I think is, kind of it's a newer service that's offered at the Plano campus. So can you kind of give a little bit more detail on that?
Scottish Rite has traditionally taken care of all aspects of pediatric and youth orthopedics, and so on the Plano campus currently, we're a little bit space challenged, and we see a lot of general orthopedic needs, but we're going to be able to expand all of that. So whether it be scoliosis screening and follow-up, whether it be hip disorders, or other just musculoskeletal concerns, whether they be foot and ankle or all the way up through shoulder care and spine care, we'll be able to do that, like I said, in a more robust way than we currently offer. And so, we're really excited about expanding that and having increased physician availability for those services.
That's really great. And I think for families, I mean, having another point of access is something that's really important. So, Jeremy, in terms of that, what is the benefit of being in Frisco and something that patient families, like I said, another point of access that'll be really helpful for them?
Right. So, 25% of our patients really come from an area surrounding Frisco. And so is one going to allow us to have, better customer service by having a facility closer to their home. That's great. But also, for our sports medicine practice to have a home that's going to be the anchor of this facility to be able to to expand those services and offer those services for the community.
That's really great. And I think, you were mentioning we're actually in our Gait Lab, future Gait Lab, which is a really cool thing that's going to be in this campus. So, Dr. Wilson, can you kind of give a little bit more detail on this Gait Lab? I know we have one at our main campus, but I know it's going to be extremely state-of-the-art, cutting edge, which is really exciting. So can you give a little insight on that?
We are really excited about the Motion Science Lab here, and that really allows us to work on clinical problems, whether it be lower or upper extremity. The technology that we'll have in the Gait Lab will allow us to look at problems that kids are experiencing, whether that be in sports or in daily life, and really analyze how the function of each joint and how their muscle function affects their overall running gait, walking gait, or whether it be throwing mechanics. And so that'll allow us to do both individual assessments, but also research projects. And a lot of what we've done historically with Scottish Rite is we research the things that are in front of us in the community, the clinical problems that kids have, and now as opposed to a lot of our traditional things that we continue to do with really a lot of focus and research. Sports is that way as well. That's what's in front of us in the community is kids' sports injuries, and our new Motion Science Lab will bring some technology to allow us to study those types of things the same way we've studied our other disorders downtown.
That's really great and so exciting. I can't wait to see what that looks like and all the research that comes from that. So I think to kind of round things out, a lot of the questions that people want to know, I mean, what's the tradition of Scottish Rite? Are we going to have popcorn at this place? Are we going to have volunteers in red coats? I mean, that's something that I think a lot of people want to know. So what can you say to that, Jeremy?
Well, absolutely. So we will for sure have popcorn here on this campus. Matter of fact, it's going to be a little bit over that direction on the first floor atrium. That popcorn, the smell can go up into the facility, and so that's very exciting. And then, of course, what would we be without our volunteers? And so we're for sure going to have volunteers. That's one thing we really want to encourage the community up here to, we're going to be starting that process, and we're going to have volunteers in every area just like we do at our main campus. So very excited about that.
Well, it's good to know that the tradition is going to continue, and popcorn will be the first smell that you take in when you come here. So I think to round out, we actually brought the rendering of the future campus.
Nice.
So we can kind of show where we're standing right now. Where are we right now?
Right here in the facility. So this is the motion science. This is the movement science lab, and we're probably about right here on the first floor.
That's awesome. Future is bright for Scottish Rite Hospital. That's a fact. Well, thank you both for coming and attending us today on our Facebook Live. We're so happy to be here, and thank you to Beck and all the construction workers for allowing us to be here. I know we're in the middle of your workday. So thanks so much. Tune in next week. We'll be back. Thank you.